Good morning, everybody. Welcome to the day 3 of Pulp 2022. So today's first lecture is by Dr.Govindool Sharaschandra, and the topic is comfort zoned in an unconventional career path. To introduce Sharash sir, it is my privilege to call Dr. M. Kavita ma'am, who is currently HOD, Department of Conservative Dentistry and Endodontics, Tamil Nadu Government Dental College and Hospital, Chennai. Ma'am has 66 publications in indexed in international and national journals and delivered 43 guest lectures. She is currently the editor-in-chief of Journal of Operative Dentistry and Endodontics and has been associated with many journals as a reviewer as well as an editor. Ma'am has received Vibrant Senior Endodontist Award 2021 by IES, Academic Excellence Award 2016 by IACDE, Good Samaritan Award 2019, and Masterclass Award 2016 by CET for conducting over 100 CDE programs as scientific chairman. It's a privilege indeed, ma'am, to introduce you. Handing over the dais to you. Welcome, ma'am.
Thank you. Thank you. Am I audible?
Yes, ma'am.
Okay. Dr. Govindool Sharaschandra is an MDS PhD, endodontic resident at School of Dental Medicine, Buffalo, New York, the senior research aide in the Department of Oral Biology since 2019. He is an awarded publisher and speaker with 35 plus research papers, workshops, scientific papers, posters, models on topics such as multi-speciality dentistry, laser therapy, endodontics, infection neutralizing dental prosthesis. He has educated and supervised research for as many as 500 undergraduates and graduates in classrooms, residencies, practices in US and India. He has secured 2 patents and serves as an ad hoc reviewer for 4 international journals. He is actively involved in dental and COVID response community initiatives for disabled, disenfranchised, and even animal populations in US and India. Actually, now he's going to talk about the comfort zone in an unconventional career path. We are eagerly awaiting to hear your lecture. Over to you, Sharash.
It's an honor to be speaking to the August gathering back home, and I shall begin with a brief introduction to my career journey. My career started at Unabad HKDET Dental College back in 1997 to 2002 when I graduated. I went on to enroll at Savitha Dental College, Chennai for my master's in endodontics, that I completed in 2009. Worked in Vaidehi Dental College for about 4.5 years while I pursued my Master of Science from Aachen University. This, I guess, is the only structured and accredited career accompanying program in lasers in the world then, and I think it still puts the position now. After my graduation in 2012, I started to look for a university to pursue my doctoral studies. I was offered positions in a few universities, but I landed in the University of Hong Kong in 2014. Here, I had the opportunity to go on an exchange under the Pilot International Research Exposure Grant to the University of Buffalo in 2017. It was when I was here that I came to be motivated to move into the United States, but I still wanted to be as a clinician rather than a lab scientist, I would say, or a basic scientist. I was advised to apply for an Indo residency program, and I did so in the very same university and was offered a residency in 2018. I joined the residency in 2019, and now after completing the program in 2021, I'm sorry, the program, I'm now a clinical assistant professor here. I'm speaking of the journey to let you all know that it's possible to go from wherever you are to where you want to be. And now moving on to the topic of the talk, choosing a career option, either clinical or research. I begin with what it takes in choosing either of these career options. And you will need to have a career plan with a little introspection as well as understanding of your own self. I would say that the main aspects is planning, and it goes in choosing a career which is either of the two. It could be clinical or research. First, you will have to know your values. That is your personal values, which is the central part of who you are and who you want to be. These are the values that you believe in, which are the most important in the way you live or work. And they should determine your priorities. Deep down, they are probably the measures that you want to tell yourself and how your life is turning and how you want it to be. Some of these life decisions are really about determining what you value the most in your life. And this leads to learning about yourself, which is to provide yourself a direction and effort taken in either of the career choices. And you will be soon encountering this the moment you graduate. And this is a transition that happens in everyone's life. The journey also begins with self-improvement, I would say, in awakening your internal belief system, in knowing your strengths and especially your weaknesses. You may be inspired or guided into a career path, and then comes the next step in your career. That would be to identify your skills and decide what skills you need to develop. Think about what you can add to your current skill set, which is very critical in trying to aim at a career that you want to pursue. I would definitely reflect on my past education, skill experiences, or skill sets. Speak to my mentors for a different perspective of myself, which is very critical. Here, I would like to share a life experience that I had. My first interest was to pursue orthodontics as my master's, or maybe even pedodontics. But my principal, Professor C.P. Rao, spoke me out of it, and he said, Sharas, with your aptitude, I think you're better off doing endodontics. And honestly, that was a life-changing advice, because probably he knew much better about my aptitude and attitude rather than my likes and dislikes. The choice of a career between clinical and research is a difficult one, but you will get to know this as you dive deep into the introspection of your vision for your life. And I believe in not directing you into either of the options, but showing you what it takes to pursue either of the careers, whether it is clinical or research, and the consequences of choosing either one of them or trying to be in both. And this is where I stop and say the decision is all yours, because as you know, it's a decision that is life-changing, and the prospect of walking a new path, and you'll be walking this path all on your own. So the first step in this direction has already been chosen in a way for a reason that you have chosen a career in dentistry, which is a very unique profession because you're already specializing in a specific area of the body, whereas the MBBS graduates do not do so. They go in with the normal stream and then they specialize in each organ systems. Now it's a challenge to acquire different skill sets than what you have already acquired, which is very unique to dentistry, and make use of what you have learned or acquired and study the differences, what you need to move into a specific domain or a transferable skill set, which you need to go into a laboratory. So giving an outline, this is a very general outline with regard to how a career path is. If you look at it broadly, it could be clinical, it could be research. And when you speak of clinical, I'm trying to just break the thought process you'll have to go through to arrive at a issue. So when you speak of clinical, you either go into clinical practice, private clinical practice, and you're a clinician, hardcore clinician. Or as a clinician, you enter into academics, where you will be teaching students, conducting some research, and involved in clinical practice, probably within the university or as a private practice. While if you get into research, here you go into hardcore research, that is, you're a basic scientist. You are not involved in any sort of a clinical in a scenario where you'll be encountering or treating patients, or if you are entering research in academics, then you will be teaching and doing a part of doing research as your core. So when you speak of this, I would first go into the clinical career as a clinician and abroad, where there are two things that you will need to know. First, you would be your licensure requirements, that are the qualifications that you have, whether they are accepted, and do you have to clear some examinations to certify that you can work in a particular country that you're going into, because each country has a different set of rules, and it's a painstaking job to navigate through each of these processes. My suggestion would be that you take a holistic view of your life and choose a country that suits to you based on many things, like extended family that is already based in a particular country. Or on a lighter note, I would say simply the fact that you presume that you would be better off in that country than the one that you are now. Once you choose a country, you want to move into researching that what it takes to get into clinical practice over there. Typically, if you look at Australia, you have the ADC that you need to clear, Australian Medical Council exams. If you look at UK, you probably have some boards. I'm not sure because I did not research into that part. But if you look at United States, you will need to clear your integrated national boards. You will need to have a TOEFL score and things like that when you're applying for your IDP International Dental Program, which is a 2-year program. Or you could be applying to residency programs, which is a little more tougher to get into unless your CV is very strong. And what then comes a vital part in moving to a new country is that of a residency requirements. So residency requirements is citizenship status or your visa status, what I speak of. So I personally have a perspective towards this is that it depends more on what your future is. If you want to retire in that country or you want to be coming back to India after your career is done or in whichever country you're trying to move. So that decides some countries where you can get your citizenships and relinquish the Indian citizenship and become a citizen of that country, or you return back to India after you finish your career in that country. Last but not least, I must say a vital aspect would be your family that takes this decision for you. If you are single, then you will have only your parents to convince. But if you're married, you will have your spouse to discuss with him or her what you need to do, or whether they are comfortable or can they pursue their careers in this country. So that also becomes a question of thing to take into account before you decide to move into a country. There are lots of opportunities that you can tap into and explore. And as I was researching for this topic, I see that a lot of countries are looking forward to utilizing the skill sets of manpower that we have in India, especially with doctors and dentists. So we recently had I think it was just on the 24th of March, as this conference is happening, Prime Minister of Australia, Scott Morrison, and Prime Minister Narendra Modi announced in one of their annual virtual meetings that they will be having a mechanism to expand educational qualification recognition, that is, between India and Australia, where they want to have an education policy that they want to implement and hoping to revamp the education system that we have now, where they will be enabling the they'll be recognizing each other's degrees, just like how the engineering is happening. They'll probably be extending this to dentists and other fields. I have my opinions on this. They considered this a brain drain in a few years back, but that's not how it is. I would say it's a brain gain because any person that who goes out of the country does not cut off his roots from the country. He definitely comes back to share his knowledge or her knowledge. So that is brain gain. So you're bringing in new knowledge, you're bringing new experiences, just as I'm trying to do right now. I'm bringing a new perspective to whatever we are doing. It's not that we don't have excellent teachers over there. It's all because of the teachers that I was taught back in India that I'm here today. But we bring in new blood into the field. So that is how I would say. And this probably will enable us to choose a career with no barriers in the future. Unfortunately, I just came across a newspaper article from a statement from an esteemed IDA state president. And he stated that there was a severe shortage of dentists in rural areas where there was a lot of money and nobody wanted to settle over there and practice over there. I'm sorry about this, but I'm very opinionated on this statement. The Constitution of India, Article 21, states that you have a right to your livelihood. And its extended jurisdiction would be that it includes basic shelter, food, education, occupation, and medical care. So don't let such statements deter your aspirations in pursuing your dreams. And let's look at another option of research as a career option, which is much less researched by you all, because I'm sure all of you all want to be clinicians. But I just want to give you a perspective on how research can also bring you out of the country and give you new avenues to relocate. So when you look at research, there are three distinct principal types of medical research. One is the basic, then you have the clinical research, and then you have the translational research. When I speak of basic research, it is looking at a question related to how nature works, while translational research aims at taking what is learned in the basic research and trying to apply it to develop some solutions in the medical field or any other field. Clinical research then takes these solutions or studies and translates them into clinical trials. Together, they form a continuous research loop. It's like a cycle that transforms ideas into action in the, and tests the former treatments and advances and cutting-edge developments from lab bench to the patient's bedside and back again. I will be elaborating this further. So when I say basic science research, here it describes something that is an essential starting point. If you think in terms of construction, you can put up with a beautiful, elegant house, but you have to put the foundation first, right? So the basic science does that. If you only understand the basic research well, then you can move into advanced applications for this basic research. The basic research is also conducted predominantly by PhD students who are students of biology or chemistry or biochemistry and life sciences. Here they study the core building blocks of life, such as DNA, cells, proteins, molecules, etc. These answer fundamental questions on their structures and how they function. This is very critical. To try to understand the basic sciences is a very valuable knowledge base from where we develop all other clinical protocols. So if you look at the translational research, here, this bridges the gap between the basic research and clinical research. And translational research is a very hot topic in today's world, where the goal is to take some knowledge from a particular biological phenomenon, which the basic scientists have discovered, and then translate it into something that can be used in a clinical setting. Some of these would be like taking the knowledge of an enzyme structure that a basic scientist has discovered and synthesizing a drug that will bind to this enzyme and block its activity. So you're like trying to build up a treatment protocol based on what is exactly happening. So you understand the process of the disease or the pathogenesis, and then you're trying to bring in clinical solutions to that. Many clinicians are doing this translation research because they are very eager to apply this knowledge and design new therapies. But you must understand that this translational research requires you to have or interact with a lot of other fields, such as engineering, it could be pharmacology, it could be any other life sciences or other subjects. And the truth is that many people who are enticed by doing this translational research very rarely end up in the process of getting the treatment into the clinical setting. You must understand research is not just a smooth path. You will be revisiting the hypothesis that you're testing. You'll be trying to revisit the data that you have generated to make sure the trend that you have established is on the right track. So all of this requires a lot of patience, right? Then comes clinical research, which explores whether these new treatment protocols or medications or diagnostic techniques are safe and effective in patients. I'm sure you all have seen the COVID situation, what we have had or we are going through right now. The vaccine, although the basic scientists had studied about the mRNA vaccines from almost 2 decades now, the process of moving it from the lab to the clinic to be used on patients was really rapid because of the time. So the translational research and the clinical research was fast forwarded, and we made sure that the vaccines were delivered to control the pandemic. So you must understand that the research here was super fast, but that does not happen in a normal traditional setting of a research. It goes through a very painstaking process of going through a number of trials, clinical trials, and establishing a certain level of safety before the drug or the treatment protocol is given out to the clinicians in the society to use it for their patients. The successful clinician, clinical researcher not only draws knowledge from their medical training or dental training, I would say, but also from knowledge, they'll require knowledge on statistics, controls, regulatory compliance, and such knowledge bases, which help them to assimilate what data they have acquired in the clinics. So saying that I will be a clinical researcher, just because you know how to treat a patient will not get you there. You will need to acquire some skills of statistics, analyzing, interpreting the data, all of that. So where do you want to put yourself in this cycle? The skill of a research person needs you to possess very specific skills, and that I'll be elaborating in a few slides as we go ahead. First, let us look at what skills you already possess, or the skills that you don't have and you will be learning as you travel your career down as a dental student. So first, you have excellent technical skills. You will be acquiring these, or you will be learning these during your course, because you will be handling a lot of materials, you will be handling a lot of equipment. You will be trained to go through a thorough and a methodological approach to any treatment protocol that you will be doing. So your mind is trained to work in a certain way, and you follow strict protocols. You will acquire exceptional manual dexterity, especially with your indirect vision and all that. Your brain is rewired, and your hands have the muscle memory to work in a certain way. You will have an excellent knowledge base, because as a dentist, I find myself at a very lucky position for a reason. We learn a lot of material science, we learn a lot of medical science as well as pharmacology. We have all the knowledge base that we need. We definitely have to focus to study, so we have the ability to focus. We develop teamwork skills, because we are working with other faculties to provide holistic treatment to our patients. We definitely develop a good communication skill along with interpersonal skill, and leadership skills soon develop as you mature in your profession. You definitely will get patience, because I know how impatient I was as a teenager, and how I evolved into being a very patient person through life. And definitely we'll develop the ability to work for long hours and often under pressure. So all of these are the skills that we possess once we graduate, or we'll be acquiring as we study. So what do you have to do when you choose research as a career option? So this is a topic why I want to talk more about, is because as a clinician, you people will have sources where they tell you. I think there's a speaker ahead of us, Ms. Rajita Shetty, if I'm right, who's speaking on what consultants can provide you with knowledge. But for research, I don't think they will give you as many options as what I have explored or identified as I walk through my career. So when we look at first basic science research, there are a lot of things that you'll be encountering when you enter into a basic science lab or a laboratory setting. So you'll definitely have to have the knowledge of using lab equipment. And I don't think it's very difficult for dentists, because we already have been handling so many equipments. We will learn. We will be fast learners. But there are some skills that we will need to acquire before we try to enter into this area of research, whereas such as cell culture, molecular biology, PCR, gene expression studies, chemistry, and a little bit of biochemistry, data analysis. So for all these things, you will need to put in a little effort to be at least having a basic fundamentals clear, and some experience to ease your transition as a clinician to laboratories. Pursuing a master's in life sciences or biomedical sciences is very much possible. There is a change in the education. I would say there's a revamp in how the education framework is back in India right now. And there is a way for us to move into MSc biochemistry or MSc in life sciences, so that you can have a transition change in your career after when you finish your dental program. And if you want to pursue a PhD, it's a prestigious degree of the highest academic level and is awarded for programs ranging across wide academic fields. So the degree of PhD requires the person to study in a particular area of the topic where he has to produce some sort of an original research in the form of thesis or a dissertation, which has to be quite extensive in its knowledge. And I guess PhD is one of the prerequisites of being a university professor or a scientist or being employed as a researcher. So if you look at the skill set that you need to develop for being a basic scientist, you have various agencies that provide these platforms for you to acquire such skill sets that will help you transit into a laboratory setting. So these are areas which I myself have used. I went to Bharatidasan University where they have this Mahatma Gandhi Donor Camp Center. So this center was trying to reduce the number of animals that we use for our research, and they were trying to use alternatives for this. So I attended a small workshop of about 11 days, but this workshop really prepared me well to enter into my PhD because I had a basic idea of how a cell culture is done or what precautions we need to take, what we shouldn't be doing. At least even if I don't know what I should be doing, I shouldn't be doing something that I shouldn't be doing, right? So I acquired those skill sets when I was there. So you have another center for training where they do training for microbiological training. So unfortunately, our education system is where we graduate from pre-university courses directly into dentistry. But here in the United States, it's not so. There's a 4-year program where there's a BSc program where the students acquire these skills as a basic science, that's Bachelor of Science, and they come into dentistry. So they already have a certain amount of background lab knowledge before they enter into clinics, and that is what helps them go into research faster. We also have the CSR, that's Center for Cellular and Molecular Biology, where you can be trained in using further techniques for molecular biology, and the other centers definitely give you. Please do not restrain yourself from only what centers that I'm showing you all here. There may be many more. These are some of the few that I've researched for this talk. When I was trying to get into NCBS, that is National Cellular and Biological Sciences Institute in Bangalore, they did not have programs exclusively for dentists. But after I asked them for such a program to be formulated to help clinicians enter into research, they have been proactive and they do have workshops now that can help you all also go into a transition from clinician to a research scientist. So the basic research skills that you need to have is you should learn how to formulate questions that are hypotheses that you need to have. You should be very good at observing, planning your experiments, collecting data, recording this data, and organizing the data. That is also very critical. More critical than this would be interpreting the data. And once you interpret the data, you will need to present the research finding that will help the clinician to understand that there is a process that is happening within the cell that is causing a disease or a pathogen, pathology. So when you look at the clinical research, this is a branch in the healthcare system that determines the safety and efficacy of, it could be medications, it could be devices, it could be diagnostic products, or any treatment protocols that is intended for human use, or even it could be for animal use. And it's basically a study of health and illness in people, if you put it as a whole package. This research has different elements of scientific investigation where it definitely involves human participation. So the new treatments that are being used has to be tried on subjects, and you will have control groups, which is why we call the whole study as a randomized control trial. So where we randomize and use patients as control group and have a testing group. And in this, once you decide to be a clinical researcher, you will need to acquire skills in entomology, a little bit of physiology and pathophysiology. So to make yourself so familiar with the disease process, as well as the whole structure of the research. Along with this, you will also have to understand that you will need to be very good at statistics, and you will need to interpret the data well, and you will need to have excellent communication skills, because once you're a clinical researcher, what happens is you are a licensing person between research and the authority agencies that regulate treatments or medications or devices. So we have the ICMR, we have the Indian Institute of Standards. Here in the US, we have the FDA, that's Food and Drug Administration. So these are the institutes that regulate our drugs or treatment protocols, which certify that these are safe. So we will be needing to communicate with these people. And over there will be people coming from all various backgrounds, not only from research, not only from medicine, but also from social work and things like that. So you will need to have very good, effective communication to make sure you make your treatment protocol understood by them and show them the benefits and things based on evidence. They will not listen to just your narratives. They will want clear evidence on in quantitative numbers for them to understand or interpret whether this protocol can be or medication can be given out to the society at large. Now comes the translational research scientist. I guess we are more a translational research scientist, because as dentists, what I find myself in a very unique position, that I can work with my patients and I do find problems in my treatment protocols or something like that. I come back into the lab to devise experiments to try and unravel what is happening, why this treatment protocol is failing, and things like that. So I guess we are having a very good skill set to move between the two, and that is the reason why I say dentists will be very good translational research scientists. So I hope that most of you all will choose either being a translational scientist, at least if not basic research scientist. And if it is you're going to be a clinical researcher, that will be the best possible scenario, because you're there in the clinics and you're enjoying the treating of patients with new treatment protocols. So now, when it comes to can you balance a career in academics, clinics, and research, try to understand that all the teachers that are teaching you all, the faculty, they have already done this, and it's an absolute yes from me, because once I see and I would like to say here, Dr. Mahalakshmi, she's been an excellent teacher, she's been an excellent researcher, and she's having a private practice. So she's one of the people that I see who has managed to balance it around all of this in Dr. Rajkumar. And these are a few names that I'm quoting whom I saw on the brochure. Other than that, I think it is possible, but absolutely it is time management that you all will need to do. And you can accomplish what you can. You need to within the time. It's only that you need to focus on what tasks you need to do and you need to finish. And also you need to delegate things so that it becomes easy for you to manage the critical aspects rather than trying to do it all by yourself, right? So each of us has to be very careful in what we plan, what we want to achieve, as well as how much of compromise in life we need to do to achieve these things. So when you look at pursuing research in foreign countries, let's see that what are the options that you have. So you have MS, that is Master of Science. This is Master of Science could be in life sciences, it could be in microbiology, it could be just in biological sciences, such broader topics. After which you could probably go back into either pursuing a PhD, or you could go into a clinical program. You also have the Master of Public Health, which is another program which is based for more of epidemiological knowledge and database studies, data information analysis. So this is another way of pursuing your transition into being a clinical researcher. So Master of Science is more moving you towards basic sciences, and MPH, I would say, would move into more clinical sciences or clinical research. And when you say Doctor of Philosophy, that is definitely the highest form of academic degree that we have. Here you would be probably spending about 4 to 6 years to maybe beyond. It depends. It depends basically on what research you're working with and how good your research funding is to support your research. There are various factors that come into account. It's not just that you will be done with your research in a time frame that is given, because you are researching, that is, you are trying to search something, right? So when I started off, my probation was done within the first 6 months. My pilot studies and things were done, and I had my plan clear, but it took me exactly 6 years to finish my PhD, although the writing part and interpretation and substitute experiments that I needed to do, all of that took a little more time. So once you decide that you want to do these, you will have to have some basic requisites, such as a good IELTS or a TOEFL score. It's preferable to have GRE scores if you're trying to apply for PhD programs. You will need to definitely have a good and consistent academic record, which is something that international universities or universities abroad definitely look for. And prior research experiences add to it being an advantage for you when you're being selected, because the pool, the talent pool that is now there available for the universities to pick and choose from is slowly on the rise. So as I told you all, you will need to develop these skills to ease your transition into a laboratory or any other setting. The fact is that you don't have to master everything, but you have the basic concepts clear, and you will be able to function as a team, and you learn as you grow in your career. So then comes the talk, is there something called a conventional career path? This is something that I was asked initially when I finished my pre-doc, that is Bachelor of Dentistry. They wanted me to pursue a career path that was traditional, and I did to a certain level. So I did my MBS, that is a traditional format. But you could probably choose that a different career path, because I've seen now students after the BDS, they move to foreign universities where even with undergraduate degrees, they can pursue their PhDs or MPhils, after which they can upgrade themselves to finishing their PhD degree. But I personally suggest that you all pursue a master's so that you get a better idea. And once you go into an academic setup, they definitely look for if you have a master's or you don't have a master's, even after you have your PhD. So that is a transition that I want you all to understand, that a master's is a better way of progressing into doing your PhD. And when you say something like a conventional career path, I don't think we can call anything conventional anymore, at least in this politically sensitive environment where everything is so strongly opinionated. Don't let this intimidate you in any way. I'm only here to narrate my journey and my perspective of a career path that I chose, but each one of you all have all the opportunities and of course the right to choose the path you want to be in. So as a summary, I would say in either of the career paths, you need to develop an aptitude and an attitude for it. There is no one path that I can say you walk this path and it will be easy for you. Life definitely throws challenges at us, and we are definitely resilient enough to work through things and pursue a career for the joy of the skill sets or the knowledge that you will be acquiring. If not, you will be ending up as another mediocre clinician or a researcher who knows how to do things, but does not have the insight to troubleshoot or formulate research ideas on his or her own. And I don't think that is a very happy situation. So I would suggest that you put in all your heart and soul into whatever career that you're pursuing. So there is a difference between knowing the path and walking the path. Now that's the beauty of life, right? So I wish you all young aspirants to be inspired to do something bigger than what you think you can do. And wishing you all a very good luck. And thank you for this opportunity once again. And I'm ready to take any questions now.
Thank you, Saras. It is very nice to hear your career journey, enlightening us about the choosing the career path and how you deeply have told about the research options what are there, and also about how to choose a country and nice tips for the younger graduates. Thank you. There is some questions, one or two questions, I think. Can we volunteer as research assistants at dental schools in US for a short period?
Well, I'm not an immigration specialist, but given the experience that I've had, I guess coming on a J1 visa is not advisable to dental graduates. I'm currently struggling to get my NORI, which is no obligation to return to India, because I came on an exchange to the United States on a J1 visa from HKU, that's the Hong Kong University. So the issue now is that they don't have clear guidelines. The ministry doesn't have a clear guidelines on whether they want dentists to come back to India. The truth is that we already have enough dentists in India, and this policy was formulated to make sure that they did not have a brain drain, what they call. Somehow I'm really annoyed and I'm angry that our fraternity has not fought for us. If you look at IITians or IIM guys, they are being totally funded by the government, and they get to leave the country and live a life that they choose. So why is our lives being put at stake just because we are doctors, just because we chose a profession? I'm really very upset about this situation that I'm in. It's been about since November, I've been struggling to get my letter, the NORI letter from the ministry. So I strongly suggest the students not to opt for a J1 visa right now, at least to the United States. But yes, if you all want to volunteer as research volunteers in other universities, I would definitely say yes, you can go ahead for that. But try to understand it's a lot of expenditure for you all to move to a country and live over there, because the foreign exchanges are not favorable with the Indian rupee. So this is a personal perspective. Again, I put all of this as a personal perspective. But if you can afford the expenses, I think, yes, it would be a valuable experience to experience things. But we do have excellent research centers back in India. The only thing is that they are not open to dentists. I don't know for what reason. I go to IIT, I guess Mahalakshmi ma'am and all the faculty members know, when I went to, when we students go to IIT or CPET in Chennai, none of them want us. I mean, they feel that we are a burden to them rather than aiding our thing. So we need to understand that there are universities abroad which have specific facilities for dental research, and that's the reason why they allow volunteers. Definitely, I would look at any other country. If they're not planning to move to the United States, they can go to Hong Kong, Singapore, Australia, European countries, any big research university which has good, excellent dental facilities. I would strongly suggest. But if it is exclusively United States, then I would strongly suggest them to look for the visa status before they try to do anything about it.
What about, you told about IIT, all these things is a fact only.
It's a very big fact, ma'am.
Impress them. Yeah, they will actually take us action. That's a true fact. Another question is, can you please enumerate some conferences in US where Indian dental students can present their research papers?
Well, the IADR, then American Dental Association, all these conferences are open for all international dental graduates. The only issue would be now with the COVID situation, the travel concerns. And specifically, they have asked for this Yankee dental conference, which I have not, I just tried to Google it and find what it was. Well, the registration details don't specify that you have to be an American citizen or anything of that sort. So they'll be more than happy to welcome you. But I did not see an invitation letter that could be sent out to foreign delegates. So look for conferences where they have letters, where they have a form where you can fill in your details and they send you an invitation letter. That makes it easier for you to get your B1, B2 visas, that is the tourist and the business visa for the United States. I specifically speak of United States because I've gone through the system. For other countries, the students will have to research for their own needs. You can come to the United States and attend conferences for sure and present papers. Definitely, they'll be more than happy to. I think Savita College in the recent past had sent a lot of graduates to the IADR or the AAD.
Yeah.
I'm not
This
sure.
year they are actually.
I remember seeing this somewhere on the Facebook or something like that. So it is very much possible, ma'am. But again, it's with the COVID situation, I think they have to take decisions very wisely because I don't want them to end up with cancellations in the last moment.
Yeah.
I think to add to that, I think they have to take into consideration the registration fees and the travel and the stay together, which will amount to a lot of this thing, unless they have someone there and, you know, they're already planning, or maybe they're asking this so that this may be one of the stepping stones to go abroad.
Conferences are definitely a place where we can interact with faculty from other schools and international
Maybe you
schools.
can get some mentors there.
Absolutely, ma'am. That's a very good starting point, because all the major collaborations that I've seen happening, at least with me, has been through conferences. So when I went to Japan, I met professors from Tokyo University. And since then, we have been interacting from Otago University. So once we interact over there, what happens is we establish a contact, first contact. And after that, if you are good with your communication skills, or if they're interested in your research, definitely they'll get back to you and you can get a research plan happening for you.
One more is how to earn using our BDS degree while studying MDS or other things in abroad. How to earn anything, any options?
I quite didn't understand the question, ma'am. I'm just trying to read the question. Is it ideal to do?
How to earn? We already a BDS degree. When we are pursuing some MDS or other things in abroad, how to earn?
No, this is another issue that students have with, at least, let me be very clear, ma'am, that I have my experience in Hong Kong, where I was paid a scholarship. So the university was very clear that the student who comes to the Hong Kong University comes with either funding from home or they provide a scholarship. But in the United States, unfortunately, taught masters, even with Hong Kong, the taught masters are never funded, at least for international students, because this is one way for the university to make money for themselves. So even the residency program that I underwent, I paid a tuition fee. So there is a tuition fee involved. And fortunately, with my research background and my PhD mentor who here, Dr. Arani, he supported me for about 6 months with the research grant. And we had an NIH grant where I was developing some LED panels for the NIH experiments within the incubator. So that sustained me for about 8 months, 6 to 8 months, I would say. But that was not sufficient to cover my tuition fees. So my tuition fees came from student loan and private personal funding, which personal saving account, I would say. So earning is very difficult. I would never say that you can rely on that. And there were programs, I think before 2000, 2000 and 2005 below, there were graduates whom I've spoken to who were fortunate enough that they had research grants which funded their residency. But of late, I don't see such things happening. And especially with the COVID situation, things have gone down south. What has happened is all the research funds have been moved or being utilized for medical care and medical research with regard to COVID. The dental funding has been cut, and we lost about $25 million for the SUNY University, that is State University of New York. And there were a lot of cuts. Right now, we are facing such situation where we are given only one device. That is, either you can own a laptop through the university or you can have a desktop. That is the amount of cuts that we are getting. Otherwise, we had both. So I would definitely say to the students, please arrange for the funds on your own. You may get some small part-time jobs in the school, which is known as CPT, that is curriculum practical training, but they are not reliable enough and they don't come in. I mean, it's very unreliable to rely on these funds. And I don't want the students to end up with a financial situation or crisis where their education or academic pursuits get affected. That is not the reason they're here for. So, and of course, if you keep your living expenses, living style less, they can spend less. So that is one suggestion that I could give, ma'am. But definitely we cannot earn a living with our visa status here in the United States.
That's what the next question also. Can we work part-time as a paid research assistant or a teacher's assistant like that?
Yes. Sorry, let me just read the question once more, ma'am. Yeah. During IDP, it is not possible. It is not possible, at least in University of Buffalo. The IDP curriculum is very intense. They'll have to achieve a lot in the 2 years that they have. And they have to understand this, that the treatment protocols that are being utilized here in the United States is far different from what is being taught to them in India or what we have. The patient management system is completely a software. So they'll need a lot of swipes or approvals before they put a patient on the chair. So all this takes a lot of effort, and 2 years is just goes by with a wink. So it is not possible for them to do any paid research. Nobody will pay an IDP student because their effort in the lab will be very inconsistent. So we cannot rely on them. Although they will have opportunities to do summer research programs. I personally have an IDP student who has got a summer research grant, which is about 5 to 6 weeks, where they do a small research, which they present as a thesis if they want to be getting a DDS with honors. But again, they are paid a very meager sum of, I think, $250 a week or something like that, which is just sufficient. It's just like a, I don't know what to say, it's a tidbit, but it will not sustain them in any way, ma'am. So there's no way that they can get this.
Kavita, can we have the last question now?
Yeah.
Oh, there's one more coming.
Yeah, is it ideal to do MSc in any dental related programs abroad after doing BDS in India?
So it's very difficult to say do this and then you'll be going ahead to pursue whatever you want to do. What I would suggest is they have to explore, each student has to explore what they want to achieve, the end goal. And an MSc in that field will obviously aid in moving towards that field. So it's very difficult to say. It's a very case-to-case basis, ma'am.
Yeah. Thank you. Nice enlightening us about the career options. Thanks a lot. Thank you, ma'am. Thank you, Maha ma'am and SRT for the nice opportunity. Thanks a lot.
Thank you, Sharas, for your wonderful enlightening the students on the perspectives abroad, basically, and also to Dr. Kavita. Thanks, Sharas. This is your certificate of appreciation.
Thank you, ma'am. Thank you so much.
And to Dr. Kavita for moderating, always there for me whenever I call her, she's there.
Thank you, ma'am.
Thank you both. Sorry, Sharas, to keep you awake so late in the night.
No, that's fine, ma'am. It's a pleasure.
Good night,
Good night, ma'am.
Thank you. Thanks a lot.
Thank you, ma'am.